The heart is the major organ of your body, and that is what we're hands-on with.
I entered the CVT program because I've always been interested in the heart and the mechanism of the heart and how it works.
We always say time is muscle. So the sooner we can get that artery opened up, the sooner their heart is getting blood and oxygen that it needs.
Heart disease is the #1 killer of women in the United States, so I knew there was a demand for it.
Heart disease runs in my family and something I was interested in helping fix.
Well, as a cardiovascular specialist, after graduation, students will be working with patients that have heart disease, heart attack victims. They will be assisting cardiologists in the diagnostic procedures where you go in, do a catheterization of the person's coronary arteries, look for any blockages.
Stent placement, angioplasty, draping and prepping the patient before procedures, and now we're learning how to set up the manifold and the transducers, getting everything ready before the procedure begins, before the cardiologist comes in.
You could be the hemodynamic tech, which is the person that sits off in another separate little room and watches all the monitors, watches the heart rate, and watches the catheterization inside the room and make sure everything is going smoothly and all the numbers are correct.
So we have our role during the procedure, cardiologist will have his or her role, and together we'll perform the procedure, hopefully get that blockage opened up, and then that way the patient can go on with, free of chest pain, free of shortness of breath. I think it takes somebody who's outgoing, somebody who likes a little excitement, because if you have somebody come in the middle of a heart attack, it's, you have to be able to handle a little bit of stress.
It's one in 27 accredited programs in the whole U.S., so this was the closest, and I heard really good things about the school.
We've had 100% placement in our program of graduates, so if they want a job, they're out there. And they're starting with a really, really decent starting salary.
I feel that the CVT program will enhance the quality of lives for those that we serve.
I love coming to school here because it's not a huge college, it's smaller scaled school, so everybody kind of knows everybody. You know everybody in your program. It's not so intimidating.
It's very, very close-knit. You're very close with your instructors, very hands-on.
Teachers have a lot more availability than, say, if you went to a larger college, where you can come in and before class or after class and ask your question, and you'll have ample amount of time to get it figured out, and everybody's willing to help and make sure you know what you're doing. So
we work with the same catheters that they have in the cath lab, wires, balloon catheters, stent catheters, pacemaker equipment. We have that all here. So then when they do go to clinicals, they're familiar with it because they will have seen it in lab. Between the first and second year, we have a summer clinical, and that's done mostly here at Altru. We go to the cath lab, we go to stress lab, cardiac rehab, different places in the hospital, so they get exposure to what their patients go through, also exposure to different potential jobs that they could get after graduation. The last year, the last fall and spring semester, the first part of fall semester is on campus here with classwork. And then the last part of that semester and the whole last spring semester is clinical work. So that's where the student goes out to the clinical site, and it's 40-hour-a-week clinical with a preceptor at a real lab. They're scrubbing in, they're doing the real procedures just like they would after graduation.
I love the rewarding feeling of getting, being there when you help somebody and their family, and just, I don't know, I love to care for people.
And when you have somebody come in that's extremely sick, and when you find the blockage and you get it open and you're visiting with the patient and they're joking with you after the procedure, the reward that you get back from that and knowing that you had a part in that, I think is so rewarding that a lot of people are like, this is awesome.